Thanks for joining us today. We're inviting Randy. How do you say your last name, Randy?
Steinley.
Steinley. Randy Steinley is our healthcare expert when it comes to cybersecurity today. And as always, the prestigious CEO of Triad InfoSec, Jason Roy, is here. So we're going to be going over how cybersecurity impacts your business if you're in the healthcare space, what you should understand as a consumer from a healthcare space, and what healthcare is doing in order to make sure that your data is safe, what that looks like from a risk reduction standpoint, different policies, procedure, plans, everything that you can consider a digital threat that we're going to talk about in order to make sure that we can do business as usual and continue to provide exceptional healthcare, regardless of where you fit in that industry, without losing your shirt. So, without further ado, Mr. Snelly, would you please give us an introduction of who you are, what you do, where you came from?
You bet. Thanks, Josh. Thanks, Jason. Good to be with you guys. I'm the CEO and co-founder of Cyber Trust Alliance, and our company was founded specifically for those purposes you just mentioned, Josh. We looked at it more specifically from the small and mid-market space in healthcare that tends to be underserved and more vulnerable as a result of that, right? Because we don't have the same budgets, the same resources to attack these challenges that enterprise does. And so we're really passionate about helping folks understand the requirements, for both regulatory and cybersecurity to protect the organization, protect the data entrusted to us. But we've come up with a hybrid solution that is a combination of virtual assessments, SaaS-based software, and coaching to work together with folks to help plug those gaps and help prevent the losses and reputational harm and so on that comes along with cyber attacks. So, Jason, I've been partners for 5, 6, 7 years.
Yeah, at least, yeah.
And so honored to work with you guys and help our mutual clients reduce their risk and try and prevent some of these things from happening.
Awesome. Well, thank you so much for joining us today. And Jason, I know our return attendees will know who you are, but for those that are just joining us for the first time, could you give us a brief intro of yourself, sir?
Yeah, Jason Rory, founder, CEO of Triad InfoSec. So for those of you not familiar with us, we are a cybersecurity GRC advisory and consulting firm. And GRC is governance, risk management, and compliance. So we work kind of in 3 different phases of cybersecurity compliance. No pun intended on the Triad name by any means, but there's the regulatory side, which is why Randy's here. We work a lot with him in healthcare compliance, but we also do financial compliance, government, military compliance with DoD, CMMC style work. Then there's also kind of the self-assessment area where if you need to do ISO 27001 or SOC 2 for contractual requirements or other, we help in that facet. And then lastly, if you're just looking for best practice compliance, aligning yourself with one of the various NIST frameworks or the CIS 18, it's just a good best practice framework to improve your security posture. We help organizations with that as well. So that is us.
Awesome. Well, thank you, gentlemen. I'm Joshua Wathen. I'm here to cause trouble and ask a bunch of questions for all of you guys attending. I work with Triad InfoSec. My job is pretty simple. I connect people and I open doors. So welcome to this open door today. Let's kick this thing off with, why should I even care about compliance when it comes to cybersecurity if I'm in the healthcare space? Like, who's telling me to do this, and what do I need to do, generally speaking, other than call you guys?
I'll take a stab at that. So the Office of Civil Rights is technically the group who is tasked with enforcing and implementing HIPAA. And HIPAA, for just to be blatantly redundant about what HIPAA is, 2 decades ago, it was released as a privacy rule that protected the civil rights of individuals, and specifically the right to keep their data private. Over the last 20 years, as we moved from paper records to digital records, in a program called Meaningful Use, where the federal government helped pay to make that migration so we could make records more readily available to providers, so your records could follow you across the country, no matter where you were. The HIPAA security rule came out that was more specifically designed to protect those digital assets, and the specific guidelines behind that. So from a regulatory standpoint, it's the Office of Civil Rights who enforces that and will come calling if you are not. But from a practical standpoint, it's based on the trust of your patients, and keeping their data private, and kind of leaving it up to them who gets to see that data and when.
Wonderful. So I do want to let everybody know that's attending. If you put a question in the Q&A or the chat, we will get those answered for you, either live or just type out an answer to you. But if you've got questions for these experts here, please don't hold back. Send them. So understanding that, okay, the Office of Civil Affairs says you have to do this. What happens if I say, man, I'm not going to do that? What do they do?
There's a lot of different things. If you look at industries across the globe, breaches of healthcare records cost about 3 times any other industry. And part of that's because health records are so rich with information. Whereas a PCI breach of credit card information, you shut off that credit card, you can really stem the tide of that pain pretty quickly. But a healthcare record typically involves financial information, address, social security number, birth date, and diagnoses. So to put it in perspective, a few years back, you might remember that there was a big breach of a website called Ashley Madison, which was people who were having affairs, right? And so on its own, that could be embarrassing, but not the end of the world. But about the same time, the federal government had a breach of every government person who had top security clearance. And within a few weeks of that, Anthem Insurance, who insures the federal government for health insurance, had a breach. So now I might know that my senator has a heart condition or cancer, God forbid, is having an affair and has top security clearance. So imagine what I might be able to do with that information. That shows us that it's not just random attacks going on. It's pretty orchestrated, and there are meaningful things behind this that people are attempting to do. So practically speaking, right, you lose the trust of your patients. Generally, when a healthcare breach happens, providers lose about 4% of their patients because they no longer trust them. Cyber insurance goes through the roof if you can even get it. And then the federal government could potentially fine and penalize you as well. So lots of different things that can happen. But at the end of the day, to me, that loss of trust with your patients is the big one, because when we do the numbers on that, for a small practice of 5 doctors, that's about $1 million out of pocket that it costs you for that lost business.
Yeah, that makes a lot of sense. So first off, correct me if I'm wrong, but I'm understanding there's kind of a perfect storm of horribleness that's going to happen if you experience a breach and you're not doing some of these things. You're going to have reputation loss, which is going to cost you customers. You may get fined by the government, and then that may lead into a whole nother type of attack where your insurance is going to go through the roof, and if your breach leads to a breach of something else, then all of a sudden you're tied up into all kinds of legal nonsense and horribleness.
Practically speaking, on average, it costs about $500 per record when you have a healthcare breach. So when you look at some of the breaches that have happened recently, you can do the math on how devastating that can be.
That's interesting.
And one of the kickers for me is, consulting in different healthcare organizations over the years. I found it kind of surprising that these healthcare providers didn't put as much effort into, the HIPAA security rule and following those guidelines. If you look at what Randy said, considering the reputational damage, the financial damage, but then to shrug it off, us as IT consultants, would tell doctors or, whoever the person is delegated to make these IT decisions, is these are things that you need to implement, to, match up with the HIPAA security rule to be compliant with that rule. And they would shrug it off. And Randy, you may correct me if I'm wrong, but it may be the same, even though it's healthcare, maybe they consider themselves a smaller practice, maybe it's private practice. They're not a hospital, a big chain of hospitals under corporate management. So going back to the small business owner's mindset, small business across all industries, too small, won't get hacked. It hadn't happened to me ever, so why do I worry about it now? And it's scary because of the amount of financial loss, and it's a huge target. Because if you look at, health records on the dark web, once they're, a breach does materialize, those records sell for $50 or $60 a record, where PII, just typical PII, may just be, dollars per record. So definitely a huge target because of all the rich information that Randy mentioned. And I just always found it kind of shocking, in our line of work, that not more attention is paid, and it takes something catastrophic to happen to get people to pay attention and do the right thing. And even some of these smaller hospitals, Randy, I don't remember the one offhand. I know they were in Louisiana. It was within the last year, they got breached, and on top of all the financial hardship they were facing, here come the OCR and slapped them with a $500,000 fine just for not doing cyber the way they should do cyber. Because in Office of Civil Rights eyes, if you would have done it right, this wouldn't have happened to begin with. So, because you were laxy daisy on your cybersecurity posture, here's extra $500,000 you got to pay out. So.
No, you read my mind. That particular case was a ransomware attack.
Mm-hmm.
First time ever the Office of Civil Rights has given out a fine for a ransomware attack. Right? Generally, they've taken the approach of, all right, you've already suffered enough. We're not going to add to it. If you're at least doing the minimum basic due diligence, we're gonna leave well enough alone. But when they went in and did an investigation of this group, they had never done a risk assessment, had no training in place, had inadequate policies and procedures in place. So when I look at it, what you just described, right, it's not going to stop every single breach. We are going to reduce the risk of those breaches happening, but you're never going to get fined if you're doing the right things, right? Because the feds they're not trying to find people. They want to help, right? They're trying to put things in place that make it better. So, but when you look at the industry right now, the feds claim earlier this year that still over 80% of healthcare fails to meet the minimum standards of HIPAA.
And I think that one of the driving factors behind that, and you may shed some light on this because I frankly just don't understand it, is there's a HIPAA security rule. You should follow this. But it's treated almost like your best practice frameworks, like NIST or the CIS. The HIPAA security rule is the best practices for the healthcare industry. And a lot of people get confused thinking, there is a such thing as like a hard stop, I'm HIPAA compliant. And there is really, you can be compliant to the rule, but there's no outside body that comes in, audits you against the rule, and then certifies you like SOC 2 or ISO or some of the other standards, like the C3 PAOs are doing in the CMMC world. I don't know. What are your thoughts on that, and why do you think that it's not more of a hard mandate?
Well, for starters, it's absolutely correct. Two things I would say. One is the federal government designed HIPAA to be flexible so it could scale up or down depending on the size of the organization and the complexity. So that works well in the enterprise space where you have resources that can interpret the rule and determine what applies to you, right? But in the SMB space, that leaves a lot of question marks, right? And to a lot of our small and mid-sized organizations that we work with, HIPAA basically says, hey, protect your data, Jason.
Do your best.
And you say, what do you mean by that? Well, really carefully, but so that's part of the problem. The other is, um, we can do an assessment for you today, and tomorrow you can have all kinds of new vulnerabilities and issues, right? Depending on what your people do, what outside threat actors do, right? So it's an evolving thing. So I think it's a slippery slope to give people a certification and say you're done,
Right.
because then people say, I'm HIPAA compliant. Well, what HIPAA compliance is to me and to our organization is constantly being in that process, right? So it's doing regular risk assessments, doing ongoing threat assessments, ongoing training of your staff, reviewing your policies and procedures, and building a culture of review, right? And so if you look at risk management lifecycle, it's assess, plan, remediate, monitor, repeat, right? And it's that ongoing process, and that's compliance with HIPAA. So it's never ending.
And nor should it be, and that's where we educate our clients, across industries, that once you start, aligning your posture with a framework, take any one of them, it never stops. You're right. It's not a one and done. You don't get the piece of paper with the pretty green checkbox and the plaque on the wall saying I'm certified, and then it stops there. No, you got to keep going. The cybersecurity program becomes a living, breathing thing. It just becomes, one more process that the organization has to maintain through the life, through, just really the whole life cycle of the organization. Because you're right, everything does change. It changes rapidly. So you have to have, someone or some company, or you outsource it, to have their finger on the pulse of that posture every day, and making sure that you are handling risk management appropriately, keeping the risk mitigated, keeping your tolerance level, your appetite, as low as it can be. So, at the end of the day, we've done everything that we needed to do to hit risk acceptance, because that's the goal. There is no elimination. You get to an acceptable level, and that's when you can sleep well at night. So that's the fight, is every day you're fighting to maintain that risk acceptance level. And in the healthcare, it's just even that much more amplified, just because of the conversation that we're having around the pure sensitivity of this type of data.
Yeah, 100%. And really, at the end of the day, what we've found is the only true bellwether, if you will, if you want to measure yourself in HIPAA, is your cyber insurance rates.
Yeah.
Right. I mean, that honestly. And so, like, one of the things we're working on right now is negotiating with cyber insurance providers, or underwriters, to get better premiums for our clients, due to the risk management work we're doing with them, right? And trying to, like, one of the things cyber insurance folks tell us is, I literally just met with a group last week in Nashville, right? And they're one of the biggest insurance writers in the country for cyber. And they said, hey, well, we build creative cyber insurance policies for folks, and we'd love to work together with you to build one for healthcare. I said, great. And they said, we said, give us an example of one you did recently. And they said, well, we built one for the National Skydiving Association.
Oh, wow.
So, I mean, you want to talk about risk, right?
Yeah.
And so they went through the whole plan with us, and we said, oh, that's awesome. Well, I mean, writing for small and mid-market healthcare should be a piece of cake. And they were like, well, healthcare is tricky. I was like, are you kidding me? We just talking about skydiving, and you're worried about small and mid-market healthcare? But it goes to show how, it's kind of the Wild West still out there. And the things that you just talked about is what keeps them up at night. And if it keeps them up at night and they can't figure out how to measure that risk adequately, then it's going to cost more.
Yeah.
Right. And that's because there's no controls and frameworks in small and mid-market organizations that they can look to and say, I understand what kind of risk I'm taking on working with this organization. So that's the kind of stuff that I know Triad is doing, and that Cyber Trust is doing, is trying to bring that type of discipline, if you will, and accountability into smaller and mid-market organizations.
Yeah. No, yeah, cyber insurance is still the wild, wild west. It's a lot better than it used to be, but on the other hand, now the carriers, as you mentioned, they see the risk that they're taking on in various industries. Yeah, obviously healthcare is going to be a huge one, and there's other industries that, based on their responsibility in their industry, the risk that they operate on a day-to-day basis, the insurance companies are like, "Whoa, hey, who'd you say? What industry did you say you were in?" No, that's yeah. I've seen some industries just be turned down. As soon as you fill out the application and say, "I'm in this industry," oh, sorry. Yeah, but in most, you're right. Your premium will dictate your posture. Unless you want to really run the even higher risk of just going through the application and answering it, we'll just say incorrectly.
Yeah.
Because we all know the insurance industry is necessary to have. Cyber insurance is a massive piece to your overall cyber program, but you do want to make sure if you say yes on that application, you are truly doing that, because if a breach happens, you file a claim and they investigate and they find out that there's some control you said yes to on the application that wasn't truly implemented, and maybe that had a hand in the breach materializing, that claim's going to get denied, and now you're left holding the bag, and that's going to be a really bad situation for any industry. So
100%. But the thing is, we know it works, right? I
yeah,
mean, we've got a client we're working with right now, and they had a breach almost 3 years ago, right? They hired us 2 years ago. We've been working together to help them understand their risk and where to invest their money in the right places to button up their security, if you will. They just renewed their cyber insurance a couple months ago, and they told us they were able to increase their coverage by $2 million. This is a fairly large organization, right? A few thousand employees and 50, 60 locations, healthcare. But they were able to increase their coverage by $2 million and decrease their premiums by over 50%. So when you look at what they pay us to assist them with that risk management work, they're actually making money on that.
yeah.
So, it works and it matters. And that to me is part of why we do what we do.
Yeah, I mean, absolutely. That's one of the things actually Josh and I were talking about earlier today, is showing organizations your return on investment when it comes to your cybersecurity program, because it's tough, because it's not tangible. You have to spend the money to protect the assets, but how do you see that it's working? And it's just that you could potentially see significant savings in insurance premiums. You could see significant savings in the financial liability if a breach does materialize, because you've invested in enough of the mitigating controls that would lessen the impact. Yeah, and so it's key to work with leadership so they understand that. So yeah, going through and helping with insurance premiums is one of the biggest things that I think we both do respectively.
Yeah. Well, and to your point, I mean, I would say I'm not going out on a limb right now saying in healthcare there are organizations that know they've been breached and those that don't realize it's already happened. But you'd be hard pressed to find a healthcare organization that hadn't been breached already.
Right.
For most, they just don't know what's happened.
Yeah, I mean, there's so many, threat actors out there that are sitting in networks as we speak that have just yet to act on it. And just
Yeah.
waiting on the right timing.
Yes, sir. And so when you look at some of these massive breaches that have been reported recently, it's no wonder cyber insurance is so expensive and why people are scared to death about that. But at the end of the day, I've talked about this before. HIPAA is not terribly complicated. It's a lot of detail, right? And you gotta go through a framework, but it doesn't have to be ridiculously expensive. It's not overly complicated. It's just one more thing that small practices, another hat they have to wear. So if you can get the right tools and processes in place and get things set up properly, then managing it ongoing doesn't have to be completely overwhelming and really can fit into your culture.
Yeah, I mean, I agree. Tools are vastly. I mean, we've worked with you for a long time, and SEBA is an amazing platform when it comes to HIPAA management. So yeah, having a tool in place to make it a little bit more efficient, more streamlined, and just easier to maintain. And I think with something is easier to maintain, it's people are willing to put in, the effort to require to keep it, where it needs to be. So.
Yes, sir. Agreed.
All right, guys, y'all got my brain working here. I've got like 10 questions written
Oh,
down, and
yeah,
I'm
yeah.
not sure which one to
We'll
ask
stop
first.
our going back and forth, and we'll pause and take a couple questions. So
Um,
far away.
okay, so one thing I'm curious about is you talked about the amount of fines and how much it costs to kind of mitigate and recover from a breach. One statistic that we've seen float around across all industries is that only 40% of small businesses survive a breach. And I'm curious if you're seeing similar statistics within the healthcare space with smaller clinics and smaller practices.
Actually, I've heard that number is, a lot worse at,
Really?
at, at the end of the day. Yeah, because, like that group that Jason mentioned earlier, right, in Louisiana, I mean, $500,000 fine to a small practice, that's devastating. And so when you look at the long tail of a breach, I've heard as high as 70% of small businesses across industry don't survive a breach in the long run. Um,
Oh,
and when you look at, like, we do a lot of work in the rural health arena, so rural hospitals and clinics, and it's even worse there, right? Because right now, just in Texas alone, somewhere around four rural hospitals at any moment are on the bridge of collapse because of financial pressure, regulatory, and so on and so forth. So there's 162 rural hospitals in Texas. So that's four or five of them right now are in jeopardy of going under. And you put the pressure of a breach on top of that, and that tips the scales pretty quick.
yeah, yeah. So I'm curious, with that $500 fine, would an insurance policy cover a fine as well as the recovery of the breach?
Depends. Depends
Okay.
on what's in your policy. I mean, Jason can speak to that better than I can. I know you've actually looked at that a lot more detail, but just depends on what's covered in your policy and what you've done for due diligence. I don't know, Jason, that's
Yeah, no, you're right. Definitely, you have to know your policy, and Randy's right. So there's two sections of a cybersecurity insurance policy. There's first and third party coverages that cover you if you're the source of the breach or you as the victim of the breach. Then there's sub limits that in certain types of breaches, the insurance may not pay out the full amount of coverage that your premium's paying for. So you just have to be aware of all of these items. So that's one of the biggest things when we do our consulting, I tell the organization, the cybersecurity insurance policy is not like homeowners insurance. It's not like auto insurance. Those rates are set against the type of car and the type of house that you have. Cyber is completely different. It's a very technical policy. So through the application process, through the quoting, review process, if you have 3 or 5 carriers that you're looking at doing your due diligence, you need to have some sort of technical help to review that to ensure that, okay, if I'm paying for a $3 million policy, that I have 3 million in coverage for ransomware or for regulatory fines or for wire fraud or for reputation rebuilding or for business income loss. All these are key things because, wire fraud is just as big as ransomware is, if not bigger, when it comes to the actual money have to be paid out, in the insurance world. And I'm not as deep into the actual insurance carrier side as I used to be. So some of my numbers may be off, but there's a lot of great data out there on breach cost and how much the average ransom is. And I think it's up well over several $100,000 on average, where I remember when ransomware kind of hit the scene, if you will, might like $5,000, something like that. But they found a way to really monetize it and monetize it in a huge way. So he's making sure that you have the insurance to help offset that financial liability if you do have ransomware, but you have to make sure that it is in your policy and is covered the right way. Because there's a lot of organizations out there who, yes, if you ask them, do you have cyber insurance? The answer is yes, but it's a small piece to a broader business policy that may have very inadequate coverages. $250,000 in cyber insurance is not going to cut it for hardly any organization in any industry of any size these days. So you have to, pay attention to that, because you definitely don't want to get caught off guard thinking you have it and maybe you do, but when you need it, it's not enough.
Yeah,
That's a bad situation to be in.
And
that makes a lot of sense.
at risk
Sorry,
of
go ahead.
cutting off your question, sorry, I just wanted to touch on one thing you said, Jason. You mentioned depending on who's responsible for the breach, right? And that's a key, because if you look at the last 18 months or so in healthcare, almost 50% of the breaches have come through a third party. So huge deal, right?
Yeah.
Looking at, like, the federal government says you have to have a certain contract in place, right? A business associate agreement. And that's something that we audit for, when we're doing risk assessments. But the other side of that, that's not required by law, is looking at the liability you take on by doing business with certain vendors, right? And so we really strongly encourage folks to look at the cybersecurity posture of their vendors and their partners, right? Because that's an extension of your business. As soon as you share those medical records with a partner, now you're both, sharing that risk. And if they're not maintaining the same standards that you are, all that hard work you're doing and all the controls you put in place could be out the door if your vendor breaches all those records on your behalf. So really important thing to keep in mind.
Yeah, vendor management is becoming a bigger and bigger part of overall compliancy out there. No matter what industry, what framework, you're going to run into a huge section of how are you evaluating your vendors on a regular basis.
Yes,
and now there's requirements where if the vendor can't produce certain answers to questionnaire or produce a SOC 2 or ISO report, then their bid is just thrown to the side.
Yeah.
Big deal. So you're absolutely right on that.
So that's a pretty good lead into one of the questions here on my notebook. I recently talked to a few executive leadership in a couple of different hospitals, and they all kind of gave me the same response. Didn't matter whether they were the CEO, CFO, COO, didn't matter. They all said that's corporate's job. And so as you're talking about vendor management, and you're talking to executives that work for a parent company, but they're making deals with different vendors. They're in charge of the training programs for their staff, things of that nature. How do you speak to that leadership that says that, look, the corporate structure is supposed to be handling this, but you need to have a certain awareness of what's going on? And, what kind of questions do you ask to, help them sleep at night and get them to understand that, look, this is kind of a all the way down to the bottom type of job, because any one person within a business can click on the wrong thing and cause a breach.
Yeah, no, you hit the nail on the head, right? You can spend $1 million on the perfect IT system, all the perfect cybersecurity, right? Put all those controls in place, and you put a human being in front of it, and all bets are off, right? Because that's the one asset, if you will, that we don't really control without training and regular updates and so on. So when we talk to folks about it, one is, hey, like I just interviewed a good friend of mine who's a privacy and security lawyer in healthcare, has been for 20 years. And I said, David, what's the biggest challenge out there? And subset of people is the fact that organizations think in terms of silos, right? And he said, most people tend to think, oh, HIPAA that's IT's job. Well, HIPAA is also legal's job. HIPAA is also HR's job. HIPAA is also executive leadership's job. And so one of the big things he stressed, which I really appreciated, was if you really want to build a culture that is, appropriate looking at these things and protecting your business, you got to get everybody in the room and get everybody on the same page, and everybody's got to get buy-in, and everybody's got to play their part. And so as an example of that, that customer I mentioned before that we worked with on their cyber insurance, right? They wanted to look at their data at the corporate level, right? The CISO said, I need to see everything that's going on in every one of our facilities. And they have 55 facilities that we manage for them, right? Then he wanted each of his regional leaders to see all the facilities they manage that roll up to them so they could take personal accountability for that. And then the leader of each individual facility needs to be able to see what's going on in their facility. So each layer of responsibility, he wanted to be able to hold people accountable for playing their part. And I think that's a perfect example of what you're talking about. And so, we regularly say to people, it's like saying it's not my job does nothing but create more liability for the organization and for you personally. So rather than asking, whose job is it, pick up the shovel and do your part and make sure that you're working on what you can control.
Yeah. That's a great point, that it is everybody's job. And so, what do you understand about your personal situation and where you're at with your business? Who do you need to be talking to underneath you to get the buy-in, and who do you need to be asking questions of from the corporate structure to realize to make sure that you have the resources in place? Because just because it's your hospital, it doesn't mean, especially you're connected to a backbone network, right? You're vulnerable even if your hospital's doing the right thing, if there's one piece of that puzzle that's broken down.
100%.
I really appreciate the culture aspect of that. I think that it's culture is kind of one of those things that can be real foo-foo, but it can also be really concrete. And so finding those pieces that need to be permeated throughout an organization that are super, super important, as opposed to the nice to haves, makes a big difference in understanding where to prioritize training.
Yeah.
So I appreciate that.
And I typically, ask people when we're talking, right? First thing is, would you agree to do this as a group, as a team, right? Not do it as a silo. 2, would you take personal responsibility for, playing your part? And 3, just think in terms of what's one thing I can do today to improve our cyber resiliency, like me personally, right? Whether it's take a training class, update my password, whatever the case may be, there's something you could do that's going to reduce the risk of the organization and to you personally. And if we each think about it from that perspective, I mean, the impact across the organization and across the industry is unbelievable compared to the way we're approaching it today.
Yep. Hey, what they say, see something, say something. That's everybody's responsibility.
Yeah.
That translated in the cyber world is something as simple as, I think this might be a spam or a phishing email. I'm not sure, but your role in that is to forward it to the IT people, let them make the decision. So you're doing your part. Yeah, because it's definitely an organizational effort for cybersecurity. And it kind of goes back to what I said earlier about then your cyber program becomes a living, breathing thing. And I'm glad, Randy, that you mentioned the CISO in your example, because that's why CISOs exist. That's why they have a seat at the leadership table with the CEO, the CFO, the COO, because has to be somebody that can watch the organization from the top down and with a focus on the security effort. And you do that through all your risk mitigation strategies. So it only takes that one person, yes, to click the wrong link, go to the wrong website, whatever the case may be. So there has to be that plan in place and somebody managing that plan to continuously test the efforts, make sure that people are attending the awareness training. You're doing phishing simulations. You're doing all of these things. You're doing pen testing, vulnerability scans, remediating on time. You're patching. You're doing it all. And as long as there's somebody there to manage that, then we kind of get back to the risk reduction and the risk acceptance. So without all those moving parts, you're sitting duck.
100%.
Makes a lot of sense. So, I think one thing I'm picking up is that healthcare is a primary target. Like you said, Jason, the healthcare records are worth more money on the dark web. I can understand the idea if I'm a bad actor that, okay, doctors make a lot of money. They could probably pay me. They've got a lot of moving pieces. There's some vulnerability there. But I really want to dial in on the records. Why is it? I understand there's more information, but what about that information is worth more to me as a bad actor? Why do I care if you had a cough in 1992 and you had a broken arm in 2003 and your record? What about the record makes it so appetizing to bad actors?
Well, there's a couple things, right? I mean, on the one hand, diagnoses can be very personal. So, having a cough may not be a big deal, but having cancer, I may not want anybody to know about it, right? Or being pregnant, or you can imagine other things. But here's an interesting article I read a couple of years ago. Typically when we talk about breaches, we talk about the cost to the organization. I've only seen one out of a few thousand articles I've read in the last 2 years that focused on the cost to the patient. And the study looked at the fact that a healthcare record gives you the entire roadmap to steal someone's identity, whereas most other breaches give you just one piece of that. So in their deal, patients whose records have been stolen and their identities compromised, the average out-of-pocket per patient was $20,000 out-of-pocket
Wow.
cash. So, and some of the things that bad actors have done in the healthcare industry is they have pushed towards holding the patients accountable, right? If the docs don't pay, they've put things on websites. They've actually started reaching, because they have the data, they've actually started reaching out and threatening boards and patients about exposing their data and things that they can do with that data to get money from them. So they've gotten really creative with how they're using that data to blackmail people of late.
That makes a lot of sense. So, especially for high net worth individuals, public personalities, there's an individual blackmail happening, not just ransomware for companies based on the follow-up of what's stolen.
Yeah, I mean,
Yeah,
so in the record, and correct me if I'm wrong, Randy, but I'm just sitting here thinking, and in my head is stolen identity via health record, and who's to say that that health record isn't full of prescriptions, data. So if you steal the identity, steal the prescription, you got that prescription filled, and if it's the right type of drugs, then there's another source of income for a bad actor. Is selling prescription drugs on the dark web that they can fund through stolen medical records.
No, that's a really good point. Because I mean, insurance fraud is a huge component of this. And so, yeah, that's a great point, Chase.
Yeah, when I think about that from a business perspective, a healthcare record is a much stronger lead for a much wider array of industries that can make money off of that lead. So if just like websites and LinkedIn get scraped in order to grab leads and get sold to companies based on where somebody might be working and whether or not they'd be a customer, a healthcare record can be a lead for many, many more types of bad actors to make money off of it than just simply a credit card number and a first and last name, right?
Yeah, that's a great analogy. That's a good way to think about it.
So, with your skydiving thing, I know Jason and I talked to another guy that runs an IT firm yesterday, and he told us that his cyber insurance policy costs him more than every other single insurance policy that he has for his business. And so I just wanted to make sure I'm understanding this correctly. That according to the insurance agencies, the likelihood of your business having a detrimental breach is more likely than you getting hurt when you're skydiving.
Yeah.
Okay, most likely.
Well, combined with the fact that if you're in the healthcare industry, the cost of the breach is so much higher
Mhm.
because of the how complete those records are and how expensive they can be on the black market. So, I mean, right now, the cost of a breach in healthcare is 3 times higher than any other industry globally. So it's a mix of the likelihood of it happening and that the money that they have to lay out for that, right? Because in healthcare, you've got to pay for insurance would likely, right? Pay for the forensics analysis, the notification of patients, which is required by law and under HIPAA, the remediation. I mean, credit counseling for the patients to help protect them from having that data do something devastating. So I mean the response to that insurance covers typically there's riders in there for reputational harm. I mean, we work with the Texas Medical Liability Trust that does cyber insurance for doctors, and they told us when they first started offering cyber insurance a few decades ago, right? They did a $50,000 rider on plans, and it was great, right? And then they did $100,000 cyber insurance rider on medical liability uh, policies, and then they started upselling additional because, Jason, you said $250,000 doesn't cut it right now for most docs. If you don't have at least $1 million of cyber insurance, it's probably not going to cut it.
Right.
Right. And so as that continues going up, I mean, you got medical liability insurance, which traditionally has been ridiculously expensive. Cyber insurance is right up there, if not worse, nowadays. It's crazy.
Yeah.
Wow. So couple of kind of two questions in one here. One is just with the economy being down, the way I see it from a battle strategist point of view is that, okay, the economy's down, less money will be spent on security. The risk is actually going to increase. So I'm curious if that's true or not. I'm also curious that, being one of the number one world power, right? We're getting attacked by other nations all the time. And infrastructure is a huge piece of that, especially healthcare. I think other than maybe water and food, healthcare might be the best way to create panic among a nation. So I'm curious, with all of those different factors kind of mixed in, what is y'all's pulse on the risk of cyber? Is it hockey sticking or going crazy? Is it just on a steady incline? Do you think that it's going to raise over the next year or two until we kind of reset the economy and figure some stuff out? Like, what's the projection of this within the healthcare industry?
I would
I mean, I've got
would
lots of opinions,
venture.
Jason. If you want to start, go ahead.
No, I mean, I would venture a guess to say that just based on my experience, that if you go back to that broken mindset where a small business owner, I've seen it in healthcare, I've seen it in other industries where, okay, we're not going to spend the money to do advanced cyber because we don't think that it's going to happen to us. They don't buy into the, if when theory. So if you take that and you roll that into a bad economy, and maybe there has to be cutbacks financially within the organization, then the cyber posture could be a victim of that. It's why am I, I traditionally they don't spend as much on cyber as they should. And when you got to tighten the belt, that's definitely one of the things that could be even further cut as well. And I feel like the adversaries out there, they will understand that because that's why small business are already such a huge target, is just from the mindset perspective. Okay, I know these guys think we're not coming, but we're going to come because they're not ready for us. They're not doing what is needed. And I saw an interesting statistic on LinkedIn. I think it was today or yesterday, that only 1/3 of small businesses actually have something as simple as MFA implemented within their business. And that just kind of goes to show you the state of the mind when it comes to cybersecurity. I read, I think it was in the Verizon breach report or one of the reports I read that 68% of the ransomware attacks that materialized into a full breach happened to businesses sub $50 million in revenue. That's a huge chunk of the small businesses in all the industries. If you go sub 250 million in revenue, that made up 99.98% of ransomware attacks. So $250 million in revenue could still be considered a small to slightly medium business. This is not happening to you. The massive enterprise MGM Grand stories, they're the ones that make the news. They're going to, but the thousands and thousands of small businesses that get infected with ransomware or other type of breaches on a daily basis, they don't make the news. So that's where it comes into the broken mindset. I'm not MGM Grand. I don't have to worry about it. Well, your neighbor had to yesterday.
Yep.
So
Amen to that.
I would say yes. A tough economy could make things worse just because that's something that would get cut when there's probably things that could stand the cut a lot easier, but maybe that's something that's tangible to the business owner that he doesn't want to reduce the spend on. So something intangible like cyber or like just even IT in general. When I ran my IT company, I seen that it was just getting rid of IT support altogether. So you're just riding in the wind, with no management whatsoever. So it can be scary.
Oh yeah. No, and I would go back even a little further. When you talk about industry trends, I think COVID and the national shutdown and the move culturally to remote work was one of the biggest things that's impacted cyber in as long as I can remember, right? Because suddenly you take most workers who are working in an office where there's at least some kind of cyber controls in place at the mothership, and you move people into their homes. And most organizations are not sitting down with somebody like Jason and talking about strategy for how to appropriately protect those remote workers and how they're logging into corporate resources, right? They set something up without the proper protections. Now I've got millions of people out in the workforce outside the mothership without the same protections, and we've created this huge liability. So I think that's a big part of it. I do think the economy is hurting a lot of organizations right now. From what I've heard in industry, people are still recognizing the need to spend for cyber, and so it's hurting other areas of the business, and people are really struggling with it. I'm hearing that people are still planning on spending more on that because there's enough happening in the news right now that at least talking to their boards, they're trying to give the impression that they're doing something about it. But I mean, during COVID, there was sort of an unwritten agreement, if you will, among hackers that they were going to leave healthcare alone, and most bad actors didn't really touch healthcare, and we didn't see a ton of breaches during COVID. Well, that's completely been lifted, and by what we've seen in the news, you can tell that they're going hard after that because there's so much rich data out there. So I just think it's increasing. People, even the percentages people are talking about spending on it is not keeping up with the number of attacks and where people need to be. So we're losing ground every day, no question about it.
Yeah, I agree.
All right, so I've got one big question for the end, but before I get to that, I wanted to ask a positive question. Since we've been kind of, hey, this is lots of threats. You better take it seriously. What is, and I understand you may not have the exact numbers, but what is the statistical reduction in risk when a company is implementing GRC measures? What's if the likelihood of them getting hacked right now is 60% over 5 years? What's the reduction in that when they're actually doing what they're supposed to be doing?
It's a tricky question, but I'll give you one specific answer. One of our clients went from breach to over 70% reduction in cyber insurance premiums. I think that's an outlier, right? Because they went from, oh my gosh, hair on fire to, really good state. Some of the hospital organizations we work with, right? We've got 25 or 30 hospitals in Texas we work with in the rural markets. They tell us on average when they're implementing risk management strategies with us and using our programs that they see on average about a 30 to 40% reduction in cyber insurance premiums. I'd say that's the closest measure of the reduction in risk that I could give you, with anything we have to look at.
Yeah, I would agree. I mean, it's hard to put a percentage on, without GRC, which GRC is just your overall management of the program, which is vastly important. Otherwise, we wouldn't be here doing what we do. So managing the program, managing it effectively, yes, is going to have a major impact on the likelihood, and hopefully the impact. If you're familiar with risk matrix, that's your quadrants, right? Likelihood versus impact. That number is going to get drastically reduced. Can I say by how much? No. I have seen numbers where with the right GRC, governance strategy in place, managing the cyber program, that the breach cost, which you hope you never have to truly understand, could be reduced from 50 to 70%. Given the right control implementation, those controls are managed, those controls are tested, and those controls work. Then if you take all this statistical data over the last decade or more with insurance claims and just other various reports from these variable sources like Verizon and like the MITRE attack framework and all the research that they do, you take all that into consideration. And I've seen where, yes, statistically that number would drop and maybe the breach cost could be reduced from 10 million to 3 million. Based on your industry, your size, the type of records, especially in healthcare, those breach costs are going to be massive.
That's great. So if you're doing what you're supposed to do, life is going to throw stuff at you one way or another. But if you're prepared, the chances of you being able to survive are pretty high. And you might even be able to make some money or save some money off of paying for some services to make sure that you're prepared because of the reduction in insurance premium. My last question is semi-topical, just because it's only been, 2.5 weeks. I was sitting down with a cyber insurance buddy the day it happened, and the question is, how is the CrowdStrike incident going to change the game? That was his words to me, was this is going to absolutely change the game. And I'm curious what y'all's thoughts are on how is this going to shift the market space. Are people going to be smarter?
Yeah, I
cost
think
more?
as unfortunate as that incident was, I really feel for it. A lot of people in our industry really felt for the ones who had to deal, with the fallout, the guys going around and had to support those machines and get those machines back online. So feel for those. But the incident did happen. I think that the numbers are the Fortune 500's lost $5.4 billion because of the outages. So yes, I think there's going to be a trickle down effect, and insurance could be one of those. There's a lot of noise out there. Like, how could anybody anticipate something like this? Because obviously there's nothing's ever happened on this scale. And there's, incident response is a must-have. Disaster recovery is a must-have. But in this scenario, it affected the end user workstations for the most part. It had a lot of effect on back-end infrastructure as well, yes. But not every organization, or hardly any at all, have a duplicate workstation laying around that doesn't have the same software that might get the same patch. And yeah, so major impact, how you prepare. It's just one of those really unfortunate things. It really was. But, from an insurance perspective and, seeing that kind of risk, that type of financial loss, because when it comes to incidents, and again, this was not a cyber incident, so let's be clear about that. It was a bad patch that affected the Windows operating system that caused the machines to blue screen and go down. Whether there's cyber insurance fallout or not, it's possible, just because part of your cyber insurance is business income loss. So if this would have been a cyber incident, then all the companies affected could have filed insurance claims to recoup the loss in revenue that they suffered while they were down until this issue got resolved. So that would have had a catastrophic effect on the cyber insurance market. I think the one shining piece to this from an insurance perspective is it wasn't a cyber incident. So as long as the carriers understand that and don't, push that risk into the wrong place, then hopefully it'll be okay.
Yeah, I'll just add a couple of quick. I know we're over time. Totally agree, right? I think calling it a cyber incident is misinformation, right? I think we have to be careful with how we talk about that. Without sounding pompous, shame on CrowdStrike and shame on Microsoft to an extent, right? These were preventable things like we've talked about before, right? Microsoft's operating system shouldn't be that susceptible to one line of code and an update from a third-party vendor. So I know Microsoft's making some significant changes on that immediately to prevent that from happening again in the future. But I also know a lot of customers are rethinking how closely they're tied to any one particular vendor and having redundancies in place. Like I know right now, my entire world is all virtual. So I would run to the store and pick up a new laptop and log back into my accounts and be back up and running. For most people, that's not possible. And we saw the impact we saw. From the CrowdStrike perspective, we know that they have the checks and balances in place that should never, ever happen, right? So so often when we have incidents like this, it's because somebody went around the designed process that's supposed to protect us from those things happening, right? And so, I think we have to learn from it. We don't have any other choice, right? We have to get better. I hope people look at it from the perspective of how can I build in more cyber resilience? How can I protect myself from these kind of things happening in the future? We've got to do better. There's enough bad actors that are making this hard.
Yeah.
We don't need to do it to ourselves.
Good point. And a good way to end.
Yeah, that's a great way to end. So I want to say thank you, Randy. Thank you, Jason, very much for joining us for another webinar. And since this is a healthcare webinar on cybersecurity, let's end with this. Complacency kills and compliance is the cure. Until next time, thank you for joining us today.
Thanks, gentlemen. Appreciate it.